take off.
Sure. I hope everyone can see my screen here. Can you see it?
Yep, we can.
Perfect. Okay, so I'll get started then. So today's workshop, the one that I'll be leading, is called Research Methods in Radiology, and I'll get into more detail on what that is. So my name is Chirag. I'm a third-year honors Bachelor of Science student at the University of Toronto. I study neuroscience and physiology. I'm also a board of directors at Rad Scholars. So I'll be presenting radiology research today, but I have skewed it a bit towards neuroscience. That's my specialty. So that's just something to keep in mind. I would also like to acknowledge Ian. He's also here in the meeting today. So Ian, if you want to say hi, you can just put something in the chat. But Ian's helped me out for the presentation today. He's a second-year Bachelor's of Science student at McMaster, and he's studying medical radiation science. He's a Rad Scholars research lead as well, so some of you may have seen him around. Perfect. So I want to start off by talking about research in radiology and where it is currently and what we usually see. So just in general, research in radiology is highly based on imaging technologies and processing software. Whatever questions or ideas that researchers might have usually do consist of clinical research involving imaging of patients. And I've put up some studies here that I thought were pretty cool. They're very recent studies. So as you can see here in the first one, it's an evaluation of breast MRIs. They're T2 weighted breast MRIs. So again, you can see that there's imaging happening in that first study. A second study is about the detection of certain artifacts in chest CTs. So again, imaging happening there. And the point I really want to get across here is that research in radiology is very, very heavily focused on imaging techniques or in radiology. So that's one of the focuses that we'll talk about today as well. Quite recently, other research focuses have also emerged, and this research focuses on an evaluation of the existing modalities and their diagnosed pathologies. So this is the one here, which is breast cancer mortality rates have stopped declining in US women younger than 40 years. A very recent study published this year, February 9th. But essentially, this type of research looks at the pathologies and the diagnoses that can be made with existing modalities of radiology and how those progress over time. So this is studies that you might come across as well when you do your research in radiology. Another focus very recently has been on social issues pertaining to radiology and medicine in general, which is the second study here, which is narrowing the gap, imaging disparities in radiology. And usually, you wouldn't think about social issues like racism or discrimination in radiology. But this study here makes a really good point in that the access of high scale or high quality radiology services is usually less to certain groups of people, which creates a disparity in the access to healthcare in clinical radiology for different demographics of people. So this is a new focus that's coming into research in radiology that I think is very important and something that anyone can do and look at the situation. So this is something to look forward to as well. So I want to get into today's focus. Today's focus, like I said, is going to be on imaging technology. I'm going to describe and evaluate imaging technology that's currently in use. We'll talk about what it is, when it's used. I know in the first workshop you talked about how to interpret images. This one's going to be a bit different in that we'll talk about the imaging techniques themselves, and we will do a few case studies just to make things interesting. Second thing we'll talk about today is trends in research. And in this section, we'll talk about what's new in radiology and where we're headed from here. Okay, so let's get started talking about diagnostic imaging modalities. I would like to say, if you have any questions while I'm speaking, just put them in the chat. I don't think I can see the chat while I'm presenting, but I'll get to the questions at the very end of the presentation. So just as soon as you get a question, just put it on the chat and I'll scroll through them at the end. Okay, so we'll start off with MRI, magnetic resonance imaging, and you might have talked about this as well in the previous workshop, but essentially on the left image on your screen here is an MRI machine. It's a big donut, and then you have two large squares, I guess, on our side of the image. The large donut shape is a large magnet that is used for the imaging, and those squares that you see are the ones that emit radio waves. And I'll explain how those two work together to create the MRI image. I found a really cool MRI image on the right to your screen up here. This isn't something that would be right here, sorry. So this isn't something that would be necessarily important in clinical imaging or research, but it's just an artistic image that someone took on an MRI that I thought was pretty cool. So it's a mother and her child MRI image. So essentially how MRI works is that it plays off the fact that your body has a large amount of water, and different tissues in your body have different amounts of water. So it composes tissues and types of tissues differentially. And what's in the water? Hydrogen atoms. What hydrogen atoms do is they have the ability of what's called precession. Precession is when the proton of that atom spins along an axis, like the Earth does. And you don't need to necessarily understand why that happens. It's just a process or an ability that hydrogen atoms have, is that they spin along an axis. And this spinning creates a magnetic field, which is essentially making each atom similar to a tiny magnet, which can be reoriented with their axes. So each atom of these each hydrogen atom in this water that composes our body is like a small magnet, and they have a north and south pole, which can then be oriented just like any other magnet that you might have experienced in your life. So now you might see how the whole magnet part of MRI comes in. That big donut I talked about is a big magnet. So over here is what's normally happening in your body. You can see the axis here, and the hydrogen atom spins in random directions around this axis. So these axes are facing random directions. When you put the person in an MRI, there's a magnet. That large magnet aligns all these axes in one direction. That means when they're spinning, they're releasing all their energy in one direction, right? And so then what we do is those squares I talked about release a radio pulse. And this radio pulse is what moves the axes to different locations. Now, you don't have to necessarily understand the exact physics of how this happens, but essentially the big magnet aligns all the axes. The radio pulse puts them in different directions, okay? And then as the radio pulse goes away, these axes return to their initial state. So the one with the magnet, their constant state. They return to that position here, as shown in this image, and as they're returning, they release energy. They release a radio signal. And this radio signal is what the MRI machine captures and images. And this energy is different, like I said, for different types of tissues because they contain different amounts of hydrogen atoms. Yeah, so if you have any questions on that, just put them in the chat. I'll get to it. Here's some examples on what sorts of images you can get from an MRI machine. Now, I'll tell you something that maybe not a lot of people who aren't familiar with brain imaging know about, is that the MRI results, just the MRI machine results in images like these, the one you see here in column A. And I don't know if anyone can notice what's weird about these images. So I'll give you a couple seconds to look at them. This is what we have normally in an MRI machine, but this is the image that you might be used to seeing in books or in TV shows. What's the difference between these two? And I'll give you a couple seconds to think about it. So The difference here, I don't know if you noticed, but is these large black spots that aren't necessarily visible in these ones. Okay, so when you just use your MRI machine, you have large spots in your image that aren't visible, or there's differences in the color and the intensity of the color. So just the pure MRI image isn't necessarily good enough for us to analyze in research or clinically. So what you have to do is you have to process it into something like this. So this image, when you process it using a software, it can turn into something like this or like this. Okay. So that software basically identifies these dark spots and fixes them. And you don't necessarily need to know how, but it uses this map. It's called a field map image to fix this brain image into a standard state of color throughout the image. And this is what scientists or doctors, clinicians can use for research and for diagnoses as well. And then to do further analysis, what you can also do is you can take out the skull and all the non-brain tissue and leave just the brain here. So you can see in this image, column D, what we've done with all these different images is that we've taken out the non-brain tissue and left just the brain. Okay. And column E just shows you the different views that you can have in an MRI image. But basically, this slide shows you the types of images that you can get from MRI and the whole process that you have to go through to get to this image here. And the software is called FSL software. Now there's a bunch of different softwares, but FSL is the one that's normally used. And what you can do is, if you're interested in this and what could help you get a position at a research hospital as well, is if you look at FSL, train yourself in FSL. And I know Oxford has a bunch of courses that you can do online for free, teaching yourself FSL. So just some interesting side note on what you can do. Another thing that softwares can do to help MRI is to tell us differences over time. Now, what's important to note is this top two images here are from an Alzheimer's patient. The bottom two here are from a normal patient. Now, this one is a 65-year-old female who has Alzheimer's. This one is a 66-year-old female who does not have Alzheimer's. And this red coloring here indicates gray matter in the brain, cortical matter. And you can see in the Alzheimer's patient, unfortunately, there's a lot of black, meaning there's a lot of decay in the gray matter, but a lot more of the gray matter is still present here in the non-Alzheimer's patient. But just these images alone really don't mean anything to us, right? Like, they tell us generally in the brain, okay, yes, there's a decay in gray matter, but that's not specific enough for us to know about different therapeutic effects and whatnot. So what we do is, what FSL does, is it looks at all these images over time and tells you, compared to normal, which parts of the brain are showing the most atrophy. Now here, this plus here is pointing to the hypothalamus. So this red here is the hypothalamus, and it's telling you that you're seeing a lot of atrophy in the hypothalamus. And this is just one place in this brain that FSL has told us that you're seeing atrophy. And clinicians and researchers can use these MRI images to make predictions, to make prognoses, and also for diagnoses on where exactly the disease is affecting that specific patient's brain. So what's important for MRI, I guess, in terms of research, is that it's used for soft tissue, detailed analysis, and it's very, very regularly used for the brain. Okay, so if you have, again, any questions on MRI, just put them in the chat. I will get to them after. So let's talk about ultrasound next. Ultrasound is a non-ionizing, non-invasive technique. It generates inaudible sound waves to produce images of anatomical structures in the body. So this here is what's called a transducer. And this transducer emits inaudible sound waves that go into the body and echo back. This transducer also records that echo and creates an image based on the echo and the time between when the sound was sent and when it came back. You're all probably aware of different marine mammals like dolphins that use echolocation. This is a very similar technique to echolocation, but it's very you know, specific to radiology and to how we image. So the basic is the same. It uses the echo of the sound sent out to generate a signal or an image. So the signal and distance of transducer to tissue boundary uh, is used to generate 2D images of organs or tissues. And the cool thing is here that it can be continuous. So with ultrasound, you can get real-time 2D images of what's going on within the body. We talked about MRI. MRI is one picture at a certain point in time, whereas ultrasound can be kind of like a movie or a video of what's happening in real time. And you can probably imagine what the implications for research would be. So you might have seen that they applied gel during an ultrasound. I just wanted to point out it's just to prevent friction and also to prevent air pockets from blocking the ultrasound waves. So you can do diagnostic ultrasound, and that is can be functional or anatomical. So anatomical is maybe something you've seen before, and that's to use ultrasound to image organs and tissues. And so the typical baby, fetus, placental ultrasounds that you see in TV shows and whatnot are anatomical diagnostic ultrasounds or anatomical ultrasounds. And functional ultrasounds used for functional techniques, create maps of physical characteristics like blood flow. So they can tell you, how is blood flowing through, for example, the carotid artery here. And it shows you this waveform, systoles, diastoles, and how they're changing over time, which can also be important in research and in clinicians as well. And you can use something called Doppler ultrasound to determine the effect of, for example, a plaque in the carotid artery on brain blood flow. So essentially, it just tells you how the blood is flowing to the brain, how much is it, and how different it is from normal when you can compare it. So you can probably imagine the implications this has on research as well. So just a bit about the uses and the applications of ultrasound. Diagnostic anatomical, like I talked about. Like I said, can be used for pregnancy scans. You can image the heart, like here. So now these are the 2D images that you're getting from the heart. And then you can compile them into a 3D image with some very new systems of ultrasound imaging as well. You can image the heart. You can vessels, eyes, thyroid, brain, breast, abdominal organs, skin, muscles. Now, ultrasound, I haven't seen so much for the brain, but it is still used in certain cases. And just something cute here is a little pregnancy image. Okay. Next, I want to talk about X-ray radiography, and this is maybe something that everyone's gone through. Some point in their life, you've had an X-ray before. So this is ionizing radiation and is usually non-invasive. You might have noticed that, ultrasound is non-ionizing radiation. This one is ionizing, which is why they tend to limit the use of X-ray as much as possible and use it when it's necessary. So most people know how X-rays work, and essentially it's high energy X-ray photons that are released from this device here that run through the tissue of the patient's body and are caught by this machine here. So essentially, though, the X-ray tube on top emits the X-rays into the patient and then onto the detector. And each type of tissue in the body absorbs X-rays to a different extent, and that's what appears as differences in color. So bones absorb X-rays more. They have a high calcium content, so they produce white or brighter images compared to less dense tissues like fat that let most of the photons go through and appear darker on the image. And you can change the amount of photons, the strength of the photons in an X-ray if you want to image softer tissue, darker tissue, denser tissue, depending on what you're researching. So if you have a research project on some sort of bone mass. You're probably going to use a higher energy um, photon compared to if you're imaging um, certain soft tissues around the bone, you're going to use a lower density, or sorry, a lower energy photon. There's different types of X-rays that can be used in research as well as clinically. So X-rays of the breast are called mammographies, and they are used very commonly to diagnose cancers, tumors, irregular shapes, and those appear very bright. And I think you saw some of those images in the workshop in the morning, some of those calcifications and those bright images that show up very clearly on a mammography X-ray that can be used to diagnose cancers. Fluoroscopy can also be used, and that's an image shown here. So these are real-time images of movement in the body to view diagnostic processes. So essentially you make a certain part of the body or a certain moving part of the body to fluoresce or to appear brighter, and you see how it moves or how it reacts within the body. It is mildly invasive. You might have to inject something like this contrast agent into the body. For example, you might want to follow the movement of the heart. So you might inject some sort of contrast agent and see where the blood flows. And you can do that through this type of fluoroscopy X-ray. Okay. And X-rays are very often used for bones, bone fractures, tumors, as well for the lungs, pneumonia, calcifications. And I think in the workshop in the morning, you looked at different types of lung X-rays and CTs, ground glass pathologies. So that all applies to research as well, especially COVID-19 research, which we'll talk about at the end of the presentation as well. You can also use X-rays for dental problems, foreign objects, and these are two things that I think everyone's seen on for themselves and on social media and media in general as well. Lastly, I want to talk about computed tomography, and this is called CT, and this is probably also something that you've heard of before. This is a computerized X-ray imaging procedure that's more precise than a regular X-ray. It's a narrow beam of X-rays, so it is again ionizing radiation aimed at the patient, and then it's quickly rotated around them. So again, this donut shape is not a magnet this time. It's just an X-ray that spins around the patient, and it creates MRI-like images of different slices in the body, and you can set how thick you want the slices to be, anywhere from 1 to 10 millimeters, maybe larger if you don't want that much precision, but you can set those slices and make sure that you get the right images. So signals are processed by the computer to generate those slices, and they're displayed individually like we saw with the MRIs, or they can be stacked together to show a 3D image of the patient, which can show skeletons, organs, tissues, any abnormalities that the physician might try to identify. In research as well, 3D images can be used to show the effects of different medications, therapies, as well as progression of different pathologies as well. Here's an image that you can get from a CT, and a CT image is usually axial, so it's cutting the body in the vertical axis usually for their imaging. So this one unfortunately has no variation. It's only a diagnostic tool because it is so involved. You can't usually use it for therapeutics, and it's a special type of X-ray radiography. Very often used for complex bone fractures because you can get very thin slices of images and you can see where the bone has fractured. It's much more specific, like I said, than a regular X-ray. Eroded joints, bone tumors, and like I said, it's greater detail. Here, you can see that bone tumor. This is your femur, the head of the femur, the bone tumor here. There's studies everywhere where you can see different images. You can see the spine up here and different abdominal organs. So you can feel free to take a look at more of these images and try to see what you can find and try to isolate different parts of the body as well. This is also used very commonly for head injuries, tumors, clots, stroke, hemorrhage, because brain matter can show up different colored on a CT scan when it's undergone hypoxia or when it's died because of hypoxia, which is a lack of oxygen. It's used very often, again, to image lungs, emphysema, pneumonia, detecting tumors or lesions in the abdomen. And we'll talk about emphysema, pneumonia, lung imaging in COVID-19 research as well as checking for anomalies in the heart, which I've seen it used sometimes. Okay, so case questions. Unfortunately, I can't see the slides, I can't see the chat, but I'm going to get you guys to use the chat in a bit, okay? So here's our first question. What sort of imaging technique do you think can be used for imaging acute appendicitis? And let's go over what this means. So we've talked about MRI, X-ray, CT, and the different subtypes of all these imaging modalities. And we want to image acute appendicitis. So where is the appendix? It's in the abdomen. And acute appendicitis is an inflammation, essentially. So you're looking at soft tissue that's enlarged or inflamed in the abdomen. So there's a hint for you. It's soft tissue. It's in the abdomen, and you want a greater specificity because you want to be able to see the minute details. As well, it might help to see in real time what's going on with acute appendicitis because it can develop very rapidly into something that requires immediate intervention. Okay, so I'll give you a couple seconds to think about this. What sort of imaging techniques do you think we can use for this? And, there's almost never one singular answer. The different imaging techniques are usually correct. So I'll just get you to type in the chat your ideas. I'll see if I can go to the chat.
Chirag, I can let you know what they type in the chat. Yeah.
Perfect.
So Yusser said ultrasound.
Yeah, perfect. Awesome. Does anyone know why ultrasound might be used? Oh, darn. All the way forward. Okay, yeah, so ultrasound. And ultrasound is generally the first imaging modality that's used for diagnosing acute appendicitis. There's an image shown here from Mosbeck et al. 2016. It decreases ionization or ionizing radiation, and it's also very cheap to do since it is acute appendicitis. They want to get an image as soon as possible. And so ultrasound is more of a convenient modality than the other ones. Now, as you can see in this image, it's pretty difficult to tell what's going on, right? And so it requires a keen eye to see where that appendicitis is and what's going on. So it's considered to have a lower sensitivity for soft tissue acute appendicitis than CT or MRI. So definitely CT and MRI can also be used, but the clinicians and researchers do tend to use ultrasound. Clinicians tend to use more ultrasound because it's just a quick and easy option in the moment. Again, if you have any questions on these case studies, just put them in the chat and I'll get to them at the end.
I wanted to just add something as well. There might have been some confusion about how ultrasound is often not very good with air. So any kind of cavity that contains air, usually you're going to end up with a bunch of artifacts. So in the case of the appendix and large bowel in general, there typically appears to be some air. In those circumstances, you can always apply compression, which is going to help remove that air a bit and kind of help you get a clean section without any air. Or, of course, you can always kind of change the patient's position so that, of course, the air kind of moves to the most dependent area. And most dependent area just means like the gravity-dependent area. So these are just kind of some of the techniques that ultrasound technologists are able to apply. And that's one way to kind of optimize their image and make sure that they're not getting any artifacts that are coming from air. So yeah.
Yeah, perfect. Yeah, thank you for bringing that up. And I saw some images when putting together this presentation on which had air in the bowel as well because it's so close to the bowel, and it creates very bright, blinding images, which can kind of obscure everything else. So, yeah, definitely, which is why ultrasound might not be the most accurate. Case 2, let's talk about this one. So, which imaging modality do you think would be best to demonstrate the liver? And let's say just in the context of cancer. So if a clinician or researcher is looking for cancer in the liver, what might be an imaging modality that would be good for them to use? Feel free to take a couple seconds, think about it. Again, this is soft tissue in the abdomen, but we want a more detailed, clear image of what's going on because these tumors can be tiny and we want to diagnose them or find them very early on in the process. So based on that, what do you think could be a good imaging modality? And I'll let you type in the chat or give a couple seconds to think about it.
Can we answer out loud?
Oh yeah, for sure. That might be a good idea as well.
Would it be a CT scan?
Yeah, for sure. So CT is an option as well. Anyone else have ideas? And I'll get to the answer on the next slide. Okay. Yay, CT. So it's best with CT, and that's based on research. That's the most used modality to diagnose liver cancers in America. And it's best with contrast enhanced CTs, and that's a different type of CT, which apparently has a very high sensitivity to these sorts of cancers, 93 to 100%. And you can see here, this is an image from a study from 2004, and they're not necessarily looking at cancers in the liver, but they're just imaging. And you can see here the liver, huge abdominal organ, and the pancreas as well is what they were looking at. So pancreatic body, tail, liver. And what's known is that ultrasound and MRI seem to have very similar accuracy when imaging the liver, but CT outperforms both of them for evaluating the abdomen outside the liver as well. So you can use ultrasound and MRI for this, but they're not as accurate as CT for the same reasons that we've talked about before. For ultrasound and for MRI, there's just not enough contrast of hydrogen atoms and different differential composition of water in the abdominal tissues for it to have very specific accuracy. So CT does outperform all of them. And the last one we'll talk about, which is something that I'm definitely interested in, relates to neuroscience, is which imaging modality do you think you would use for an acute ischemic stroke? And so what that is, it's a sudden onset stroke caused by a blockage in the blood vessel, and we'll talk about it in context of the brain. So, for example, the middle cerebral artery or the carotid artery getting blocked, and all of a sudden the parts of the brain not having oxygen, and ischemia results. So, neurons start to die because they don't have enough oxygen to survive. So here we're imaging the brain, and we're looking at the same types of tissue. So we're looking at gray matter, white matter, but we want to see how it's been impacted by ischemia. I'll give you a couple of seconds to think about it. And if you do have any ideas, anything to add, just put your mic on, I guess, and just let us know. Okay, any ideas before I move on to the answer? I'll give you like 5 seconds more if anyone wants to speak.
So someone mentioned CT.
Yeah, CT is definitely there because it can be precise, and I'll get more into it on the next slide, but yes, definitely CT. Okay. So case three, it kind of depends. CT is definitely there, like someone mentioned. So we have CT on the left image here. So this one, and MRI on the right. And I think it's very clear to see where the ischemia is happening on both of these images. But what we have to do is we have to weigh the benefits and the deficiencies of both these techniques. So MRI is more accurate for ischemic strokes specifically. Now, I won't talk about other types of strokes. And you can probably tell that too, right? Like you can see very brightly, very clearly here with the T1 or T2 weighted MRIs and diffusion MRIs. And here as well that there's something going on here, and that's the site of the ischemic stroke. Whereas on the CT, it's not as visible. It's definitely visible, but not as accurate. But the thing with diffusion MRI is that it's much, much more expensive and not as accessible as CT. So again, based on the research, most clinicians, most researchers tend to work with CTs for ischemic stroke because it's just more available. And I hope you're getting the sense of that as well, is that research and clinical radiology is very limited by access to technology, which kind of harkens back to the social impacts I talked about in the beginning, and I'll touch on that a bit at the end as well. But any questions on case three, CT versus MRI for this? It's a question of access and accuracy. But if you have any questions, just put them in the chat and I'll get to them at the end. Okay. So kind of our last section for today is trends in research. And I want to first talk about what's new in research. In radiology, we're getting a lot into machine learning for pathologies. Now you have, for one brain, for example, you can get hundreds and hundreds of images. And if you do those images over time, so let's say when the person was 45 versus 46 versus 47 years of age, right? And you have all these different images, you can have thousands and thousands of images for a single patient. And it can be difficult for a clinician or researcher to look at all of them. So we use machine learning and softwares to help make it all easier. Here, this researcher here is talking specifically about subsolid nodules in the lungs, I believe. Yep. And it's talking about a deep learning based super resolution algorithm. Now he's focusing on making the resolution better for clinicians to look at the lung images. And this is a similar algorithm to what I talked about with the brain. Right, those big black spots that you are seeing in the MRI are being corrected using a resolution algorithm. And he wants to use deep learning to make that algorithm more correct and better, basically, for the different patients that you get, the different participants in your studies that you get. He also talks about in this paper automatically locating subsolid nodules via an algorithm. Now it's in an early stage, but essentially they can put these images through a software, and the software can highlight sections that are aberrant or that don't conform to the norms of that anatomy, and it flags it for review for the clinician or the researcher, which kind of helps because you don't have to look at 1,000 images over and over again to see if there's anything different or anything major to review. But machine learning and softwares and AI is definitely something up and coming in radiology research. Very relevant to today, radiology and COVID-19. Now, if you might remember in the very beginning of the pandemic, when COVID tests weren't as available, we relied very much on chest imaging, X-rays, CTs to a lower extent, but to look at some of those pathologies. And you might have talked about ground glass imaging in the first workshop. So we're looking at similar images in COVID-19 research during the beginning. Now we're more reliant on PCRs and NATs, but this was definitely applicable then, and it is still applicable now because we're imaging the lungs for diagnosis and evaluation of long haulers, people who've had COVID for a very long time, to see what the impacts are, long-term effects are on the lungs, right? So we're definitely not using radiology as much anymore for the frontline effort. It's moved more towards a research to see what is the impact of COVID-19, what predisposes people to COVID-19, and what are the anatomical, physiological factors that do all that stuff. So here, this is a really cool paper, and I think reviews and commentaries are very much more relevant now than they were before, especially with COVID-19, because there's so much research coming out, and we want to have a summary of what's going on. So again, radiology, this paper's in radiology, Canadol, here's the DOI, but do read it over. It's a very interesting paper, published this month itself, so very relevant as well. For organs like the brain, which is my specialty, like I mentioned, we're noticing minute cortical lesions in the brain after in some long haulers. So especially for secondary organs of impact like the brain for COVID-19, radiology research is becoming really, really relevant in telling us what we can expect in patients in the future. So if you want to learn more about it, just go on Radiology, which is the journal, and search up reviews, and they'll tell you all about radiology and how it's impacting the COVID-19 pandemic. And last advancement I want to talk about is radiography tech in novel locations. So this might not seem all that amazing, but there's a movement to include imaging modalities in new locations. MRIs, CTs, ultrasounds. They weren't always necessarily available everywhere. Now there's a big movement to have these modalities available at different parts of the hospital as well. So you wouldn't necessarily have a suite where you have to purposely go for imaging. It would just generally be dispersed throughout healthcare facilities. Obstetrics and angiography suites are of particular concern and of key to that movement. So here it says, is MRI and the angiographic suite a new frontier? And they're talking about how it should be there and whatnot, because it aids in real time with invasive procedures to minimize risk and evaluate success. When you're doing procedures like C-sections, angiographies, you want to know exactly what's going on and where it's going on, so you can minimize risk to the patient, and including radiography tech, radiology tech in those locations helps clinicians reduce the risk to patients. So last thing I want to talk about trends in research is the people behind the studies. These are the researchers and where they come from, who they are, and how that's changed over time. Talking about an international perspective, historically, we've seen that North America and Europe have been the hubs for radiology research. That's just because technology was widely available to researchers. But recently, we've seen a downward trend in Canada, US, and the UK in the amount of research in radiology being output to the world. Which is concerning, but it's heartening to see everyone here today, and hopefully we can change this trend, at least in Canada, back up and have more research being published here. But the top 3 countries publishing right now are America, which is seeing a downward trend, but it's responsible for 43% of radiology research out there. UK is 9.9, which is also experiencing a downward trend, and Japan is a newcomer with 8.08% and going up. But other countries like Japan, France, Germany, South Korea, Italy, Spain, Turkey, China, Switzerland are all experiencing increases in the amount of radiology research that they're publishing. So it's great to see that so many countries around the world are participating in this as well. But a little concerning to see that in Canada and the US as well, we're seeing that downward trend, which hopefully we can turn around. Another important trend I want to talk about is female authorship. How many female researchers are primary authors and publishing in high impact journals like AJR or Radiology? And this is really important because publication in peer-reviewed journals is very essential to academic career advancement. So this research gives us information on the trends in female authorship, and they reflect the current status of females in radiology research and the future directions of women in academic medicine. And what this study found was that, still in 2021, female authorship remains less common than male authorship across almost every medical specialty, including radiology. And as much as we'd like to say that we're very progressive in the sciences, there were two periods of time where the research found that there was an increase in female authorship that was between 1991, 1993, and 2011 and 2013, which is still quite far back. The latest time they saw an increase in female authorship was in 2013, and then it's been flat. So we do have to see what we can do to decrease the disparity here between the genders in research. And it's great to see such a diverse group here today, and hopefully we can turn that around in the future. But I want to make sure that these social impacts and social factors of research are something that you future researchers are aware of when getting into this field. But that's it from me. Thank you all so much for coming and for listening. My email's over here. In case you have questions, comments, concerns, I'd love feedback as well on today's workshop. It's c.chopra@maileutoronto.ca. But please do reach out if you want anything, have any comments and whatnot, just some references. So